Important facts about novel coronavirus 2019 ncov, also known as 2019 Wuhan coronavirus. The novel coronavirus 2019 ncov, informally known as the Wuhan coronavirus. It is a contagious virus that causes respiratory infection and has shown evidence of human-to-human transmission, first identified by authorities in Wuhan, Hubei, China, as the cause of the ongoing 2019-20 Wuhan coronavirus outbreak. It is a kind of common virus that causes an infection in your nose, sinuses, or upper throat. Most coronaviruses spread the same way other cold-causing viruses do, through infected people coughing and sneezing, by touching an infected person's hands or face, or by touching things such as doorknobs that infected people have touched. The first known human infection occurred in early December 2019. Molecular clock approaches suggest a similar, or slightly earlier, date of origin. An outbreak of 2019 ncov was first detected in Wuhan, China, in mid-December 2019. A phylogenetic study based on published genomes suggests that the transmission was likely from a single infected animal. The virus subsequently spread to other provinces of mainland China and other countries, including Thailand, Japan, Taiwan, South Korea, Australia, France, and the United States. As of the 30th of January 2020, 2 o'clock Coordinated Universal Time, there were 7,783 confirmed cases of infection, of which 7,678 were within mainland China. Cases outside China, to date, were people who have either traveled from Wuhan, or were in direct contact with someone who traveled from the area. The number of deaths was 170 as of the 30th of January 2020, 2 o'clock Coordinated Universal Time. Human-to-human spread was first confirmed in Guangdong, China, on the 20th of January 2020. Some 7,711 people in China are now confirmed to have the infection, which has spread from Wuhan's Hubei province to every one of China's 31 provinces. South Korea has confirmed 2 new cases of coronavirus, bringing the total in the country to 6. Of the 2, one patient recently returned from Wuhan, but the other was confirmed to be the country's first human-to-human transmission, the Korea Centers for Disease Control and Prevention (KCDC) said. 3 new cases of coronavirus have emerged in Vietnam, the official health ministry said, bringing the number of active cases in the country to 4. 1 case of the virus has been reported in Cambodia. India has reported its first case of the coronavirus in the southern state of Kerala, the government said in a statement. The patient, a student at Wuhan University, has tested positive for the virus and is stable and in isolation at a hospital, the statement added. Philippine health officials have confirmed the first case of the new coronavirus in the country. A 38-year-old Chinese woman, who arrived in the country from Wuhan on January 21, tested positive for the novel coronavirus, Health Secretary Francisco Duque told a news conference. No specific treatment is currently available, so treatment is focused on alleviation of symptoms, which may include fever, dry cough, and shortness of breath. 2019 ncov belongs to the broad family of viruses known as coronaviruses. Other coronaviruses are capable of causing illnesses ranging from the common cold to more severe diseases such as the Middle East Respiratory Syndrome (MERS) and Severe Acute Respiratory Syndrome (SARS). It is the 7th known coronavirus to infect people, after 229E, NL63, OC43, HKU1, MERS-CoV, and SARS-CoV. What is a coronavirus? Coronaviruses were first identified in the 1960s, but we don't know where they come from. They get their name from their crown-like shape. Sometimes, but not often, a coronavirus can infect both animals and humans. Coronaviruses are types of viruses that typically affect the respiratory tract of mammals, including humans. They are associated with the common cold, pneumonia, and severe acute respiratory syndrome (SARS), and can also affect the gut. Coronavirus infection is a highly contagious infection of dogs that primarily attacks the intestinal tract. The disease is spread from dog to dog through contact with feces. After coronavirus has been transmitted to a dog, the incubation development period of the disease can be as short as 1 to 4 days. Coronaviruses are a large family of ribonucleic acid (RNA) viruses capable of infecting humans and a number of animal species. In humans, coronaviruses may cause a range of illnesses from the common cold to severe acute respiratory syndrome, SARS. Other known coronaviruses are SARS and MERS-CoV. What are the precautions for coronavirus? CDC recommends standard, contact, and airborne precautions for management of hospitalized patients with known or suspected MERS-CoV infection. The CDC's recommendations are consistent with those recommended for the coronavirus that caused severe acute respiratory syndrome, SARS. Common symptoms of coronavirus. Most coronaviruses are similar to any other upper respiratory infection, including runny nose, coughing, sore throat, and sometimes a fever. In most cases, you won't know whether you have a coronavirus or a different cold-causing virus, such as rhinovirus. You could get lab tests, including nose and throat cultures and blood work, to find out whether your cold was caused by a coronavirus, but there's no reason to. The test results wouldn't change how you treat your symptoms, which typically go away in a few days. But if a coronavirus infection spreads to the lower respiratory tract, your windpipe in your lungs, it can cause pneumonia, especially in older people, people with heart disease, or people with weakened immune systems. There is no vaccine for coronavirus. To help prevent a coronavirus infection, do the same things you do to avoid the common cold. Wash your hands thoroughly with soap and warm water or with an alcohol-based hand sanitizer. Keep your hands and fingers away from your eyes, nose, and mouth. Avoid close contact with people who are infected. You treat a coronavirus infection the same way you treat a cold. Get plenty of rest. Drink fluids. Take over-the-counter medicine for a sore throat and fever. But don't give aspirin to children or teens younger than 19, use ibuprofen or acetaminophen instead. Human-to-human transmission of the virus has been confirmed. The best weapon to fight against ncov is to trust God and pray. 2 Chronicles 7:14 If my people, which are called by my name, shall humble themselves, and pray, and seek my face, and turn from their wicked ways, then will I hear from heaven, and will forgive their sin, and heal their land. References: www.wikipedia.com, www.who.com, King James Version Bible. Visit FB page, Emerald Ticketing Services. Don't forget to subscribe for more videos with my channel Travel Buddy. To God be all the glory.